has been made kidney disease, periodontal disease, we talked about teeth earlier, depression and mood disorders. And this is key because there are a lot of us, who are suffering from depression, and it could very well, a lot of other factors, that could be involved, but the link has been made where it could very well be we're not having enough vitamin D in our body. Multiple sclerosis. We talked about bad bone health earlier, vulnerability to inflammation, which is related to the autoimmune deficiency issues. Rheumatoid arthritis, also related to the inflammation. Neuromuscular health, and even the common colds. Your vulnerability to the cold and the flu has now been connected with research to vitamin D, and the latest one that's been connected is Alzheimer's. And I'm gonna, at the end, I'm gonna pass out the research. I'm not just gonna have to come up here and tell you something and say, "Oh, just take my word for it." Don't take my word for it. I mean, we did the research so we can have the information right. We want you to have that research, and the handout that we have has at least the key stuff for the especially the more controversial information, the vital information. So the research has been done, and it's not, segmented to one area of science. It kind of goes the whole gambit. So heart disease, cancer, cerebrovascular disease, stroke, diabetes, these are the leading causes of death for older black people. And these are the very first things on this list. For a long time you had, scientists and doctors scratching their heads trying to figure out why black people are dying from these things more than anybody else. Even when they factor in your education, your economic situation, what part of the world you live in, what part of America you live in. This has been done in other parts of the world. They still cannot figure out what the correlation, but the correlation is there. It's right there. All these things are chronic diseases that you're more likely to be afflicted with if you have vitamin D deficiencies, and we have epidemic vitamin D deficiencies. The death rate from diabetes is nearly twice as high in blacks as in whites in America. Mortality rates for prostate cancer are significantly higher among black men compared to white men, and are inversely related to the availability of ultraviolet radiation. In other words, the availability of vitamin D from sun exposure. This is from the Journal of Nutrition. And just so we don't think that this is necessarily some segment of this information is out there. All these journals are published, by NIST, by CDC, by NIH. This information, they have this information, they put it out there, just not to you and I, right? African Americans have lower vitamin D levels and reduced health outcomes compared to white Americans. Vitamin D status is a major contributor to health care costs in African American veterans compared to white veterans. This was a study recently done with veterans. Low serum levels of vitamin D are associated with increased cardiovascular mortality in a nationally represented U.S. sample. Black-white differences in vitamin D levels may contribute to excess cardiovascular mortality in blacks. Mortality rates from prostate cancer are significantly higher among black men compared to white men, and inversely related to the availability of ultraviolet radiation. In other words, the availability of vitamin D from sun exposure. That's where they are. Improved vitamin D status is essential to chronic disease prevention in blacks. I'm going to repeat that. Improved vitamin D status is essential. Essential means that you can't have it unless you resolve this issue, the chronic disease prevention in blacks. This is a Journal of Nutrition and Annals of Family Health. These are Journal of National Medical Association. These are all publications. These are not fringe. These are conventional, government-sponsored, published, put out there. But the information is not being put out to us. How can something this vital be kept under wraps. And this is not all new stuff. Some of this is very, very old. So what are the sources of vitamin D? Somebody asked me that earlier. We know the sun, but there are dietary sources. You've got food like fish, shrimp, egg yolk in particular, cereals are fortified with vitamin D is added to it, dairy is added to it, all types of dairy, and mushrooms. Now, this is an area that I'm not going to get too deep into, but mushrooms are the only non-animal products that have been found to have any levels of vitamin D, any significant levels of vitamin D. And if you're a vegetarian, the only natural source, not fortified, but natural source of vitamin D you're going to get is mushrooms. But there's a slight problem with that. It's a different type of vitamin D. It's vitamin D2. And our body, when we get out in the sun, makes vitamin D3. Our body functions are adapted to function with vitamin D3. Vitamin D2 is a substitute for vitamin D3, but unfortunately it's not exactly designed for our body. And a lot of recent research, especially dealing with prostate and other issues, have actually not shown an improved result from supplementing with vitamin D2 as opposed to vitamin D3. So basically what it's saying is that in a lot of cases vitamin D2 can help our chronic illnesses and our general health, but in some instances, because our body functions with it's like a mixture of various shapes. You know, compounds. We think of compounds as just these loosely moving things, but in reality, you know, there are all types of cycles that organs and cells in your body go through, and the shape of the molecule is key. There's enough of a difference between vitamin D2 and 3 that in some instances, in functions in our body, they've actually found that vitamin D2 is not a supplement, a good substitute for vitamin D3. And unfortunately, vitamin D3 is only made by animals, us, and other animals. Go ahead.
Research I've done reveals that dandelion greens are high in vitamin D. I'm not sure about the breakdown between 2 and 3.
D or D?
D, but
Which D?
Which D? I'm not sure which D.
Right.
Dandelion greens.
Yeah, that's interesting. And if I were to guess, I would probably say it's vitamin D2 because of the relationship to mushrooms and those types of plants. But it's, you know, the research is really pouring in as we're sitting here in terms of, because it's become evident how important it is. You know, so a lot of stuff is coming out. That may very well be true. But it's important for us to know that distinction, that there is actually a difference in the two, and our body does not respond the same to both of them. As a matter of fact, even when you have function of vitamin D2, our body has a harder time absorbing it. Something called a bioavailability. You know about you take vitamins, take all the vitamins in the world, depending on the vitamins you take, your body may not be able to absorb it, and it'll go through your system and it'll go right out. Because when it comes down to that compound, your body needs to recognize it and know how to use it. You know, so there's a lot of issues with absorption, with bioavailability, with bioactivity, that makes a difference between the two.
And in terms of mushroom, I understand shiitake is supposed to be the
highest concentration, right? And it's interesting because with mushrooms, the mushrooms make their vitamin D from the sun as well. It's the same way we do. It's just they make a different type because they're obviously without mushrooms. But yes, and they've actually shown increased levels of vitamin D in mushrooms by just exposing them to more sun. And this is another kind of interesting thing. If you go to the doctor today and say, I want to get a vitamin D deficiency check, and the kits I think cost about $100 to actually do to get yourself, but insurance may cover it. But they do it and they say, okay, your vitamin D is low, which most of us in here I can almost guarantee is low. we're just not in the right place. We can, so we can all go back to Africa and resolve that problem, but until we're prepared to do that, we gotta survive